Coping with COVID and In It Together SC present Wellness Wednesday, brought to you by the Diabetes Action Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Tre Tailor.
Hi, I'm Kimberly Aiken-Cochran. As Miss America, I know that taking care of yourself is important. Part of taking care of your health is knowing if you're at risk of type 2 diabetes. Prediabetes is serious and puts you at risk for developing type 2 diabetes. 90% of South Carolinians who have it don't know they have it. Visit inittogethersc.org. Take an online test to find out your risk and join a diabetes prevention program. Brought to you by the Diabetes Action Council of South Carolina.
Wellness Wednesday. I'm Tre Tailor, and thank you so much for joining us for Wellness Wednesday on Coping with COVID from In It Together SC and the Diabetes Action Council. It is World AIDS Day, and we are speaking to a champion in the South Carolina fight against the disease. And for those who are affected by HIV/AIDS, Carmen Julius is CEO of Palmetto AIDS Life Support Services, and her community outreach specialist, Audrey Moody, also joins us. Ladies, thank you so much for joining us today.
Thank you for having us.
Absolutely. Plus, Shelli Quenga joins us from Palmetto Project. It's a nonprofit insurance company, and she's going to share all the information we need to know about healthcare and Medicare sign up. Shelli, thank you so much. First timer right here on Coping with COVID. We appreciate you, lady.
Thanks. Glad to be here.
All right, great. Thanks. That and more coming up next on Coping with COVID. But first, your COVID community updates. The FDA has approved the first COVID pill, saying the benefits far outweigh the risks, which include potential birth defects if used during pregnancy. Because of that, the 1310 vote carried a recommendation for required pregnancy testing. The antiviral pill is already authorized in the UK and would be taken twice a day for 5 days a week to reduce and sometimes prevent COVID and its symptoms. Many USC staff members will have to be vaccinated. The school says it will comply with the executive order and require full and part-time staff and student employees who work through or are in any way associated with a federal contract. Also, employees that come in contact at work with staff who are under a federal contract will also be required to be vaccinated. Employees were notified earlier this week and have to comply by January 18th. Meanwhile, a federal judge has blocked President Biden's mandate that healthcare workers get vaccinated. This after 14 states, including South Carolina and Georgia, filed lawsuits saying the ruling was unlawful and unconstitutional. The case will likely be decided by a higher court. Visit scdhec.gov for the most up-to-date list of times, dates, and location for COVID vaccinations, tests, and flu shots in South Carolina. COVID vaccines for vets are being taken care of by the VA. If you are a veteran, please contact the VA for COVID tests and vaccinations. Also, several retailers are offering the vaccination, including those for children 5 and over. Kroger pharmacies are offering COVID vaccinations. You can look at the screen for more details. CVS also offers vaccinations at locations, including those in Target stores. The Brooklyn Baptist Church has a vaccine clinic open 7 days a week, and they are also doing testing and vaccinations for children 5+. And the library also has free self-collection kits at several of the library locations. Also, if you are concerned about how to get to your vaccination, don't miss your shot. The Comet bus system is giving free rides to get your vaccination, and you can catch the Comet to do just that. Online registration is being offered also from Get Set Up. If you or someone you know or senior is having some technology challenges and unable to make your COVID vaccination appointment, you can call the folks at Get Set Up to get set up. Now, FEMA is continuing to offer their COVID funeral reimbursement. If you have a loved one that passed away due to COVID, you can contact FEMA for reimbursement for funeral expenses. Several financial resources are also available in and around South Carolina, including the South Carolina Bar Association and SC Legal Services. They have a toll-free number and website for rental and mortgage help. Lexington County has a bill assistance program. SC Housing and Dominion Energy Assistance has a program for rent and utilities. And SC Housing also has a frontline workers home buying assistance program that you can take advantage of. The Fifth Circuit Solicitor's Office is doing their No Judge, No Jail event beginning next week. You've got 4 days to attend the bench warrant resolution court and get back on track. 2 locations, one out in the Northeast at Rehoboth, and then one at Bible Way Church of Atlas Road. Also, Lexington County is having a job fair today for emergency services positions. Many of these positions start at $19.21 an hour. You can see that information on the screen. Please post and share this information out. A lot of people in need of a job right now, and there are lots of positions available. Finally, if you or someone you know is having a challenge coping with COVID, contact SC Hopes. It's a 24-hour assistance line from the South Carolina Department of Mental Health. Don't forget that all of this information that we just shared will be scrolling at the bottom of the screen throughout the show. So please continue to post and share this information out so we can get the message to the masses. In It Together and the Diabetes Action Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. We're actually streaming live on the In It Together Facebook page. Please go over there, hit like and follow and share so that not only you can get notifications as to when to watch Wellness Wednesday, but there is so much great information on that In It Together Facebook page about diabetes prevention programs, fitness and wellness tips, and so much more. Check it out, the In It Together Facebook page. We're also streaming live on the home of Coping with COVID on Facebook. It's the Tailor-Made Production page. Please go over there and also hit like and share and follow and get notifications as to when to watch Coping with COVID. Wednesday, Thursday, and Friday, 2 p.m. Eastern Standard Time, and first Monday with comedian George Wallace. You can also watch our previously aired Coping with COVID shows. We're also streaming live on YouTube, and we have a presence on Instagram. Hey, don't forget to please hit the subscribe button on that YouTube page. I'm Tre Tailor, and you are watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. Again, Wellness Wednesday is brought to you by In It Together SC and the Diabetes Action Council. Well, it's World AIDS Day, and some 40 years since the CDC officially reported the first case of what is now known as AIDS, and a day where we mourn and remember the over 36 million people, including 700,000 in the United States, who have passed away from an AIDS-related illness. Today, nearly 38 million people in the world live with HIV, 1.2 million in the United States. One of the organizations that have led the way in support and advocacy is Palss, Palmetto Aid Life Support Services. Carmen Julius is the CEO, and Audrey Moody is the Community Outreach Coordinator. They join us today to talk about AIDS during this World AIDS Day. Ladies, thank you so much for joining us. We appreciate it.
Thank you.
Thank you.
Absolutely, absolutely. I mentioned, Carmen, some of the numbers in the world and in the United States. What are the numbers here in South Carolina and in Richland County of people who are living with HIV/AIDS?
Well, according to the CDC's data, there's about 20,000, there's over 20,000 people in South Carolina living with HIV. We have an annual new infection rate of about 700. That means 700 persons a year are becoming newly infected with HIV. Of those folks who are infected with HIV or living with HIV, about 17% are unaware of their status. They don't know that they are living with HIV, and that's very concerning to us. Now, our numbers sound alarming, and they are. They're much better than they used to be, and that's thanks to a lot of work from a lot of people in our community, a lot of communication, a lot of education about HIV, and a lot of HIV testing going on in our community. So we're really glad that we are making a dent in these numbers and keeping people alive longer and working to end the HIV epidemic.
Yeah, that is encouraging. Carmen, why do you think it is getting better? And that's a great thing, that it is getting better. And it is there like you said, the numbers may sound alarming, but you are getting better. So what do you attribute that to?
I think it is that we have all begun to take ownership of HIV. I think that we have all begun to be educated. We're hearing more about HIV. We're not whispering about it in dark corners. We are having open, honest, and frank conversations about HIV and HIV prevention. We're talking about those behaviors that put persons at risk for HIV. And I think that as we're working to end the epidemic, we are also working to focus resources where they need to be, in the areas where they need to be focused on, and in the populations that are hard to reach, and the populations who may not have as much access to healthcare information and healthcare services.
Yeah, you mentioned something that I want to talk about a little bit later, but I do want to ask now, where, Audrey, are you seeing where are there some concerns, and what demographic are there some concerns?
Well, I would definitely say just continuing to go out there, do outreach, because our goal is to diagnose, treat, prevent, and respond. And so where there will be some barriers, I would say, is just getting people to continue to go out there, conduct outreach, get the people the education that's needed, because education is very important. If you get an understanding of what it's about, it'll better help you want to more come in and get tested.
Is there a certain oh, go ahead. I'm sorry, Carmen.
I was going to say, and that stigma around HIV is what keeps us from being able to openly discuss HIV. We have, our clients who often say they feel like they're the only person they know living with HIV. And that is because HIV is so stigmatized. We're not having those open discussions.
Yeah.
And certainly we are seeing, a great burden of HIV in communities of color, particularly among African American men, and particularly African American men who have sex with men. But percentage-wise, the percentage of African Americans in our country, and versus the percentage of African Americans who are living with HIV and are at risk of HIV is wildly diverse. We certainly know that those are issues that are related to privilege, that are related to resources, and related to poverty, and all those kinds of things. So.
And if I may add, Ms. Tre Tailor, definitely, I believe it starts at home. We have a lot of younger people who come in who's diagnosed, and it's fear of how their family treat them, having to communicate with their family about it. And so I think it definitely starts at home. I feel like as parents with young children growing up in this world right now, we need to begin to continue educating about HIV. Is very vital. Home.
What age do you think is a good age to start talking to kids about HIV and AIDS and sexuality, I guess?
Well, I would definitely say middle school, because you do have a lot of middle school children who, at home, moms and dad may not know, but are actually sexually active. And so I believe middle school is a great age to start with educating kids about HIV.
Right.
And I also think even as young as elementary school, we teach our children to take care of their bodies.
Right.
We teach them to brush their teeth, wash their face, keep clean. We teach them hygiene. And this goes right along with that, protecting your body and taking care of your body. And so those conversations can begin at a very young age. We don't have to necessarily connect them to sexuality at 3, 4, 5, 6, 7 years of age. But certainly we can talk about the respect that one should have for your own body. And that goes with everything, hygiene and diet and exercise and all those kinds of things that we talk to our children about. That goes hand in hand with that. So I agree. Middle school, many parents would be surprised at the experiences that their middle schoolers have had. So I think that, moving into middle school is a good time to begin those conversations about how precious your body is in protecting your body.
Yeah, we're talking to Carmen, Julius, and Audrey Moody. They're with Palmetto AIDS Life Support Services here in Columbia, South Carolina. It's World AIDS Day, and you're watching Coping with COVID. In it together, SC and the Diabetes Action Council of South Carolina present Wellness Wednesday right here on Wednesdays on Coping with COVID. Tell us about some of the services and resources you provide at Palmetto AIDS Life Support Services.
Well, certainly we provide HIV and STI testing. We're currently also providing COVID testing and COVID vaccine. Audrey is our project coordinator for our COVID uptake project. We provide case management. We assist with housing, short-term rent, utility, and mortgage assistance. We have a food pantry. We provide high-impact prevention, those kinds of programs, education, and services that help people identify the behaviors that they're engaging in that put them at risk and help them lower their risk. We also provide HIV primary care. We provide medical care here on site for persons living with HIV, persons who need treatment for other sexually transmitted illnesses, including hepatitis. We do treatment for hepatitis here on site also. We have a pharmacy where we can assist people with getting medications that they need if they don't have the funds to cover those. So there's a variety of activities, and Audrey may want to talk with you a little bit about our outreach and community activities. We do a lot of testing in the community. We have a mobile unit that we utilize, and Audrey's group does some work with our outreach.
Yes, ma'am. And so we, as far as the outreach is concerned, we do go out in the community very frequently. It's very important to be out there because a lot of times in order to be heard or seen, to get the information out there, you have to go out there and actually be in the process of the community. And so as far as our outreach is concerned, we do have a lot of different things that we have going on. Again, like she said, we do HIV testing, we do COVID testing. We initiate PrEP. We do go into like children's homes, as far as like the Family Children's Center. We go to a lot of different churches. And so we're doing a lot of different outreach just to be out there in the community so people can know that we are here and we are here to help. And we want you to come in and get the services that's offered to you.
Right, that's great. Audrey Moody is with Palmetto AIDS Life Support Services. She's a community outreach coordinator. We're also talking to Carmen Julius, who is CEO. Alyssa Robillard says, when we were talking about early education, she says it's important and it's fundamental. Thank you, Alyssa, so much for watching. And I want to continue to encourage everybody to really post and share this information out so we can get this message to the masses, because as Carmen and both Audrey say, it is one of those things that people there's still, even 40 years later, a stigma attached. It's a hush hush thing. Look, people don't even want to talk about sex, more or less, AIDS, HIV. So, but it's one of those things, as you said, Carmen, I mean, and I tell you, when you guys were saying, middle school, I was about to clutch my pearls, and then I thought, but you're right. I mean, kids are so exposed to so many things. And I'm going to tell you, I'm so conscientious about it now, since I've got two little ones, how sexualized even cartoons are.
Yes.
Cartoons for little kids
Absolutely.
are so sexualized, and such adult humor and themes. I mean, I don't know really what to have them to watch anymore. So, so I get what you're saying, and the other thing I'll tell you, Carmen, when you were saying even 3, 4, 5-year-olds, you've got to have them be conscientious about their body. I mean, my little 5-year-old Julius, he saw something on TV where, and it may or may not have been an innocent little pat on the bottom, but now he's starting to try to pat his sister on the bottom. I mean, I was like, those are your privates. Those are your private parts. And you don't touch anybody's private parts, and you don't let anybody else touch them. So, just that kind of basic level, as you were saying, conscientiousness about, your body and what to do and what not to do kind of stuff.
Mm-hmm.
Absolutely. And we know that, persons who are diagnosed with HIV as a teenager or as a young adult, the behaviors that they were engaging in that put them at risk didn't start the day before.
Right.
Often these are behaviors that have gone on for years. Well, but folks were never educated or informed that those are high risk behaviors, or that
Yeah.
those, I can't tell you how many times people have said to me, well, everybody else was doing it. That's kind of the society we live in. We kind of
Right.
have that peer pressure, and we want to fit in, and we want to be cool, and we want to do the things that other people are doing. So, we have to kind of intervene in those behaviors. We have to figure out a way to educate and intervene at an earlier age. For persons who are diagnosed at 17, 18, 19, 20, 25 even, those behaviors began when they were much younger.
Oh,
much
yeah. Mm-hmm. Yeah.
Definitely.
The president just launched his strategy, you guys may have heard, to end AIDS by 2030. What do you think it's going to take to attain that, Carmen? Because you've been in the game a long time, since the beginning.
Mhm.
And I want to be able to retire with the epidemic ended.
Yeah.
I want to be able to sit at home and know that we have reduced.
There's no need for a Palss. Yeah.
Right. I think that the efforts to end the epidemic are wonderful. I think this is awesome. This is where we needed to be a long time ago. We just had to figure it out. Actually, the theme of World AIDS Day this year is ending the epidemic. Equitable access, everyone's voice. And I think that is what is needed. Everyone needs access to care, treatment, information, prevention, education, and everyone should have a voice at the table. When we talk about HIV and HIV prevention, oftentimes this information is coming from researchers and from scientists. We need to involve people living with HIV. Let them tell their stories. Let them give us information and input. And we do that on the local level. We have something called a community advisory board. There are persons living with HIV or persons who have risk for HIV. They give us information about where to go to find people, where to advertise, where to market our services, how people can receive our services. And we have created services around that input. So we must involve people living with HIV. And I have to say, when we talk about ending the HIV epidemic, I don't want us to forget that there are people living with HIV now. People who need care, people who need compassion, people who need access to services. And we can't, as we're talking about ending the epidemic, we have to make sure that we're also talking about increasing quality of life for persons living with HIV.
That's Carmen Julius. She's CEO of Palss. Audrey Moody also joins us. She is a community outreach coordinator. I want to talk a little bit more about the president's plan, tell you about some of the strategies he is looking at, and I want to get your input on it. One, engage and encourage the private sector.
Oh, absolutely. Because again, this is an epidemic of all of us. It is and I know it is seen as a public health issue, but we are the public.
Right. That's right.
And that includes those public-private partnerships. We have to get, because again, we're talking about resources, and we're talking about focusing resources where they need to be. And we need the power and the influence of the private sector to help us do that.
One of the other strategies President Biden says he is working on to end AIDS by 2030 is reforming HIV criminalization laws. What do you think about that?
Absolutely. Again, why are we criminalizing people living with HIV? I mean, I never got that. And I don't know, Audrey, if you want to jump in there. I've never understood that. And I think that is part of what is driving the rate of new HIV cases, that we have criminalized the disease. I mean, basically, that's what has happened. And I think there's a group here in South Carolina called the South Carolina Dream Team. They are actively working to decriminalize HIV in our state. And there are groups like that all across the country who are actively working on the decriminalization of HIV. And we applaud their efforts and support them.
Now, where is the criminalization coming? Is it transmission? How are HIV/AIDS patients being criminalized?
So definitely, I want to say it is transmission. But when you think about it, if you just go back, any person who is being diagnosed with a disease or a compromised immune system, and they're just finding out for the first time, that's alone is detrimental to them. And so you're dealing with that all by yourself. Then you have to focus on the laws as far as transmission and as far as being criminalized. I think it really is harsh. And I think that it has to be a continuous fight to get it changed. So it is very, very important and very crucial to work on that criminalization law.
Yeah. A couple more things I want to mention about President Biden's strategy to end AIDS by 2030, providing better access to health care for those at risk.
Absolutely vital. Absolutely vital. And again, I think early on in the epidemic, HIV is an expensive disease. It is expensive. It costs a person over the course of their lifetime, a person living with HIV is going to spend at least $500,000 on care, treatment, medication. I don't have $500,000 laying around.
Yeah.
I mean, who does? So, access to care, access to medication, access to insurance coverages. In our state, we did not do the Medicaid expansion.
Right.
Medicaid expansion would have benefited so many persons living with HIV in order to have access to medication and access to care and access to specialty care that's often needed for a person with an illness like HIV. So that is vital. That is life-saving. You literally can buy your life if you have insurance, and if you don't, your healthcare is going to be sketchy at best. I mean, agencies like Palss and others around the state and around the country, we're doing our best to cobble together a healthcare system for persons living with HIV who are uninsured. And, it is a challenge and it's difficult, and persons are ill because they cannot afford medication or they don't realize that there are resources where they can get medication. Most people are afraid of the cost of care. I mean, whether you have HIV or not, the cost of care is daunting. But if for a person living with HIV, it's even more frightening.
Yeah. Two more things I want to, mention that President Biden is focusing on those who are aging, providing them a better quality of life, and then addressing the stigma is the last one.
Right. Well, the good thing is that people are living longer with HIV. Living longer means a lot of things. For any person, as we age, we begin to experience some different things. Some of the middle age illnesses, high blood pressure, cholesterol, diabetes, those kinds of things may occur on top of living with HIV. Just the normal process of aging is challenging. And when on top of that, you're having to deal with HIV, and we're talking about stigma. When you go to the doctor, you got to tell your whole story all over again. For every physician you go to, you got to tell that story over and over again. And that's traumatizing. It literally is traumatizing. So again, a lot of people just opt out of care. They just decide not to deal with it.
Yeah.
And that's to the detriment of their own health.
Yeah. We're talking to Carmen, Julius, and Audrey Moody. They're with Palmetto AIDS Life Support Services. I'm Tre Tailor. You're watching Coping with COVID, and we're in Wellness Wednesday from In It Together SC and the Diabetes Action Council of South Carolina. Before I let you go, Carmen and Audrey, I want to ask, and you mentioned a little bit about diabetes, but how does AIDS affect someone with pre-existing conditions like diabetes, heart disease, high blood pressure?
Well, we know diabetes causes a person to have a compromised immune system, as does HIV. So, it's kind of like that double whammy. And then, and I'm not a physician, so I can't talk about this intelligently, but, you got this intermix of medications and, what you can't eat and what you can take with this I mean, it can be quite a challenge. And it just becomes more difficult to manage your health care. Often you may have to see multiple physicians. You may have to have specialty care again, which is expensive. And, when we talk about resources or lack thereof, some people just don't have the resources to do that. And we often talk about people managing diabetes and managing their HIV, and that's easier said than done. I always tell people that, everyone doesn't live like you do. You may be a person who has insurance, and so you're able to go see your primary care doctor and your specialty care doctor and get this medication, that medication. Everyone does not have that privilege. And so we have to be aware of that when we're talking with our legislators, when we're voting, when we're doing those kinds of things. We have to think about the health of our community as a whole. We all want to be healthy. We want to have a healthy community so that we can thrive, and so that this is a great place to live and a great place to grow your family. So we just want to make sure that we are caring not for just ourselves, but others in our community also.
As we wrap up, I want to know what's needed in South Carolina, ladies, in Richland County to address HIV/AIDS. Are you getting the support you need?
I feel like we are. With me being an outreach specialist, my goal is to definitely make sure that people who are living with HIV is staying in care and getting the care that they needed. And so I feel like we are getting the help that we need now, today in 2021, versus years ago. Things are changing, and I think that is a grateful thing for our people who are out there that's living with HIV. Things are changing and things are getting better. I just have one thing that I always feel like they should focus on to a whole lot more when it comes to people living with HIV. You always have a lot of people who are having a hard time financially and with housing. And housing is a barrier for people who are living with HIV. And we believe that if you can meet the needs of people when it comes to their well-being as far as housing is concerned, that will help keep people in care. And so that is one need that I always like to see people fight for, the housing for people who are living with HIV to help them stay and remain in care.
Right. All right. Audrey Moody and Carmen Julius with Palmetto AIDS Life Support Services. Their information is on the screen. If you need more information, resources, services, all of the stuff that they provide, you can contact Palss at PALSS.org. Ladies, thank you so much for joining us today. We appreciate always just your advocacy and efforts in our community. Thank you again so much.
Thank you.
Thank you, Trey.
Absolutely. Well, 'tis the season to sign up for healthcare, and the deadline for Medicaid is coming up soon. To give us the information needed, we're going to talk to Shelli Quenga with Palmetto Project. She joins us next on Coping with COVID.
Hello, my name is Kimberly Aiken-Cockrum. I was Miss America in 1994. As a result of that, I had to learn at a very early age that it's important to take care of my health, to get enough rest, to eat a balanced diet, and to get exercise. Those are principles that I still live by today. Take a moment to visit inittogethersc.org to take an online test to find out if you're at risk of prediabetes and how to join a diabetes prevention program that takes the guesswork out of losing weight, eating better, and being more active. You can learn new ways to stay healthy and sustain those changes over time. When you join, you'll get support from a trained lifestyle coach to help you set and achieve realistic goals. Go to inittogethersc.org. Brought to you by the Diabetes Action Council of South Carolina.
Let Palmetto Painting Services take the worry out of your next home painting project. We can paint anything. Our business is about interior painting and exterior painting. We offer services for residential and commercial properties. Restore the life to your home with a fresh coat of paint from Palmetto Painting Services. References are available upon request. Give us a call at 803-546-4570 today.
Computers, they're a part of our everyday life. But when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821.
The Comet gives me a reliable source of transportation.
It's very convenient to me, and they have wonderful drivers.
It's clean, and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
Comet's always going to be there, and it gets me everywhere I need to go.
We try to ride every single day. Comet is our livelihood.
Hey there, I'm Tre Tailor, and you are watching Wellness Wednesday. In It Together SC and the Diabetes Action Council of South Carolina present Wellness Wednesday right here on Coping with COVID, and I'm Tre Tailor. Hey, don't forget, we are streaming live on the In It Together Facebook page. Please go over there, hit like and share and follow so that you can check out not only Coping with COVID on Wednesdays, but all of the other great resources available on the In It Together website and Facebook page. We're also streaming live on the TailorMade production page on Facebook. Please go over there, hit like and share and follow. Also, find out when you can watch Coping with COVID Wednesday, Thursday, and Friday at 2 p.m. Eastern Standard Time, and first Monday, Fun Day Monday, with comedian George Wallace. Please also like and follow and subscribe to our YouTube channel. And check out Coping with COVID with Tre Tailor. Well, 'tis the season to enroll for healthcare. Plus, the Medicare enrollment deadline is fast approaching. To tell us what we need to know, Shelli Quenga oversees programming and advocacy at South Carolina's first statewide nonprofit insurance company. Shelli, thank you so much for joining us today, and welcome to Coping with COVID.
I'm glad to be here.
Great. Tell us first about Palmetto Project. That's interesting, a nonprofit insurance company.
Sure. So Palmetto Project actually has been around in our state for over 35 years.
Wow.
So if you go to vote and you get your I voted sticker, you know Palmetto Project.
Oh, yeah, you're right.
Yeah,
I didn't even think about that.
Absolutely. And then, of course, in the Midlands, Families Helping Families is a huge holiday gift program that Palmetto Project has been running for almost 23 years, I think. So we do a lot of different things, but we've been working on healthcare access for over 25 years and really saw the Affordable Care Act as the first major step in our organization's lifetime of being able to move forward with ensuring that people have access to quality, preventive, primary, and specialty health care.
Awesome. Awesome. Well, let's first talk about this deadline for Medicare. It's this week. What do we need to know? We're hearing a lot of people talking about it.
Oh, and I'm sure if you're of Medicare age, you have been inundated with mail and phone calls. And if you're watching TV, you see those ads all the time. So the deadline to make a change to your plan is December 7th. So this is called the annual enrollment period. So people can make changes to their Medicare Advantage plan, or if they have a Medicare supplement, they may want to take a look at prescription drug plans and make a change to those to make sure they're in the right plan for January 1st.
Okay. Now, how can they do that?
There are so many ways now since COVID. The insurance industry has really stepped up. So you can make changes by calling your insurance company directly, but we would suggest that you speak with someone local who knows the networks, the doctors, the hospitals in your area, because you really can't save any money if you're not able to access the providers that care for you, if you can't afford to purchase your medicine. So you need to talk to somebody who will tell you how much your medication is going to cost next year to make sure you can still afford it, and make sure that you can still see the doctors you need to see next year. You can call us. We can do things virtually through, Zoom kind of platforms, or we can also do things through text message even. So there are all different kinds of ways, including in-person home visits.
Is there anything new? Are there new plans or features or anything people need to be aware of?
There are always new plans. So we encourage people for that reason to always check. Don't assume that the insurance company is doing what's best for you. They're not. They're doing what's best for them.
Yeah.
So you need to make sure that the plan that you're in for next year does meet your needs. Maybe your prescriptions have changed through the year. Maybe you're seeing new doctors. So you need to make sure that you're in the best plan for you every year. We call it doing a Medicare checkup. You just need to do that check yourself, because if you don't, nobody else is going to do that for you. You've
Right.
got to ask for help to figure that out.
Let's talk a little bit about, because you said if you are of Medicare age, who qualifies for Medicare?
Sure. So the largest group of people who qualify are people who have turned 65.
Okay.
So when you turn 65, then most of us are eligible for Medicare Part A, which covers hospitals. If you're still working at 65, though, you may still have your employer-sponsored coverage. So you are not required to enroll in Medicare then. But whenever you leave your employer coverage, then you could enroll in Medicare. Or if you have been found disabled by the Social Security Administration 24 months after you have been found eligible, then you are eligible for Medicare.
Okay.
So you could be under 65 and be eligible if you have disability.
And you could be 65 and still not be eligible because of your income. Is that correct?
No, it would be
Okay.
if you had other coverage.
Okay,
So
I
if
got
you
you.
had like employer-sponsored coverage, you don't have to enroll in Medicare at that time. You could stay with your employer coverage.
Gotcha. We're talking to Shelli Quenga. She is Director of Programs at Palmetto Project, and there is South Carolina's first nonprofit insurance agency, and we're talking about healthcare enrollment. What's the difference between Medicare and Medicaid? People get those mixed up a lot,
So many,
including me.
they do. So Medicare is generally for people who are over age 65 or who are found disabled. Medicaid covers most of the children in our state.
Okay.
It is a public-private program between the state and the federal government. So there are different categories. Generally, if you are a healthy, childless adult, Medicaid is not there for you. Medicaid is for pregnant women, typically, people with disabilities, children. And if you are a very low income senior over the age of 65, in order to save money on Medicare, you have to apply for Medicaid.
Gotcha.
So it is incredibly confusing. Medicare,
Yeah.
I think, is the most confusing system we have in our country. So it really means don't be ashamed of reaching out and asking for help.
And I was going to say that's why there are people like you at Palmetto Project that can help decipher all of that out. And I love the fact that you guys are nonprofit, and no disrespect to any other insurance agent area, but listen, you guys are nonprofit. You're not in it for profit, you know.
Exactly.
So I think it's a safe and reliable place to call and reach out to if people want more information. Now we were talking about Medicare, Medicaid, healthcare enrollment is open. Look, while we were at it right here just now, I just got a notification on my phone.
Healthcare.gov was going bing, bing, bing.
Yeah. So tell us about the enrollment. I've started, going online, looking at plans. And so tell us what's going on with that.
Sure. So insurance enrollment for people who are not offered Medicare or employer-sponsored coverage, TRICARE or VA, then they can get coverage through the Affordable Care Act, going to someplace like healthcare.gov, or Health Sherpa is another place that you can go. Outside of those two, though, don't go anywhere else. Don't even type in healthcare.com, because you will get spammed to death by folks who are primarily trying to sell you short-term plans. So if anyone starts asking you health questions, well, have you had a cancer diagnosis? Tell me about your last 5 years of medical appointments. That's a clue to you that is a short-term health plan that is not going to cover pre-existing conditions.
Wow.
So the Affordable Care Act requires that everyone have access to coverage regardless of pre-existing conditions. You can't be turned down. You can't pay more because you've had a pre-existing condition. Short-term health plans are very different. So they may look attractive financially, but they are not going to help you with any condition that you've experienced before.
Oh, that's good to know. I mean, listen, we are getting scammed every kind of way. So it's not
Yes.
any surprise that this could also open a potential of being scammed. Any new things to consider about, and you know what I tell you, I've been getting a lot of emails about go silver, consider the silver plans because you can get more something.
Right,
Yeah.
right. So most people, more than 9 out of 10 people in South Carolina qualify for financial assistance to lower
Okay.
the cost of the premium. But an additional almost 7 out of 10 people in South Carolina qualify for lowered cost of using your care. So that's that cost sharing reduction in the silver metal plans. Then that will lower the cost of your copays, your deductible, and your max out of pocket. So that's how a person, let's say a single person making $15,000 can get a plan with a $0 premium with a maximum out of pocket of like $625.
Oh, wow.
Meaning even if they were in the hospital for months, the most they would pay for their health care is $625. And then the insurance company would pay everything else after that.
Yeah, that's a great point that you make because there are certain things you should look for, not necessarily what your premium is
Exactly.
or deductibles, but out of pocket. Is one thing more important to look at than something else like that out of pocket?
No, there's really no single litmus test that would apply to every person. Because, for example, if you have somebody who knows they're needing a knee surgery, it might be better for them to be in a plan that just has the one high deductible, go ahead and pay out the $625 and be done. For another person who doesn't need to go to the doctor very often, doesn't have anything coming up, a copay along the way is probably better than knowing you have to pay the first $625. So it really does pay then to talk to a professional, tell them a little bit about how you use your health insurance, what kinds of care you need to go to. I, for example, am a diabetic. That means that I need to get labs drawn every 3 months. So I need to take that into consideration when I'm looking at my cost.
Yeah, that is such great information because, listen, it can boggle your mind just looking at it. It really, I know me, listen, I'm so clear about what I can and cannot do. And it was just looking like hieroglyphics looking at that healthcare job. And there were a lot of great plans. But I'd love to, try, because I've been thinking about maybe considering talking to somebody to make sure I'm getting the right thing. Because as you just said, it's what's important. You got to look at what your situation is, what out of pocket. Because as you were talking, I was sitting up here thinking, because I was looking at a plan. One plan was 0 payments every month, but the out of pocket was $6,500.
Right.
But there was another plan that was $100 a month. So over a year, that's $1,200. I'll never get to the $6,500. But Shelli, until you said it, the light bulb didn't go off in my head.
Right. Yeah. So for a lot of people, those $0 bronze plans are perfect. And if you do something like the Bronze 4 plan with Blue Cross Blue Shield of South Carolina, then that also has a flat copay so that if you do get sick, you're not thinking about that huge deductible. You just pay your $40 when you go to your primary care doctor. And then in all of these plans sold through the Affordable Care Act, all of your preventive care is free. So you're not even paying that copay when you go to get your annual physical, when you go to get your flu shot, your annual gynecological exam, if you're of age to need a colonoscopy, prostate screening, mammogram, birth control is 100% free.
All of that's free.
And all of the plans sold through healthcare.gov.
Yeah, that's why it's so important, as you know, I'm preaching to the choir to make sure. I mean, that's why the healthcare coverage was so huge and was so important, and why it's important for people to take the opportunity and advantage of enrolling, because if you can get your preventative care done, I mean, everything else is gravy.
Right. I mean, in the old days, we would look at our plans and go, okay, so if I have to get a colonoscopy, that's probably going to be about $1,000.
Right.
Now you don't even have to worry about that. So rethinking how you are budgeting for your healthcare, that's totally different when your preventive care is covered.
Well, people want more information about how to enroll, what to do. They can contact Palmetto Project. If we can put the number up, please call Palmetto Project or log on to their website. I don't see the phone number, but I do see the palmettoproject.org email address, website, palmettoproject.org.
Yes.
Is there a phone number that people can
There
call?
is. So we have a toll-free number that is 888-998-4646. 888-998-4646.
All right.
And we can help people over the phone. We've got until December 15th for healthcare.gov, and that would get your coverage started on January 1st.
All right. December 15th for healthcare.gov, December 7th for
Medicare.
For Medicare. Make sure you contact the folks at Palmetto Project via their website or by the phone. And I'm sure the earlier the better, huh, Shelli? Because on the week of December 14th, it's going to be crazy, right?
It is. So those are our 2 a.m. kind of days where we are just trying to get everybody enrolled, because it's just, it's life changing. As your previous guests were saying, access is everything. And we are here year round. So it's not even just making sure that you have that insurance card. It's making sure that you know how to use it.
Yeah.
Because whether you have a $0 premium or you're paying a premium, we're all paying for this through our taxes. So it's important that you use the care now that you've purchased. We want you to see your doctor when you're well to do that preventive care, because then when you're sick, your doctor is much better able to discern what exactly is going on with you. So we really want you to do that preventive care so that they know you when you're well and can help you when you're sick.
Great. The information is scrolling at the bottom of the screen, palmettoproject.org and 888-998-4646, because the other thing I was thinking about was the health savings account. That's another thing people really need to be more conscientious about, because again, with me, that's something I was looking at too. Some of them have the health savings account, some of them don't. And then I had to think, am I in a situation where I need to have the health savings account,
Yeah. So a lot of times if you're a self-employed person, then having that health savings account set up, then when you're shopping for plans, you only want to shop for a plan that has an HD designation on it. Those are the only plans that will work with your health savings account.
Quickly explain to people what the health savings account is.
So it helps you to put away pre-tax dollars to use for your premium and for any of your healthcare expenses. So the Affordable Care Act and healthcare.gov were really, I think, just game changers for self-employed people. And in particular for women. I think it's really helped to free us from a corporate structure to allow us to be able to work jobs that work with our families and the things that we all need to do to make our lives work with kids and all of their activities. So it let you leave that, noose of employer-sponsored coverage and feel confident that you would be able to get health insurance as a self-employed person, as an entrepreneur. So I love that about the Affordable Care Act.
Yeah, please continue to post and share this information out. December 15th is the deadline for health care coverage, and then December 7th for Medicare. Anything else we need to know, Shelli, as these deadlines are fast approaching?
Well, do beware of people who are trying to scam you. Look for those local people whose names and faces you know and trust. If they don't know the difference between a Prisma network and a Lexington Medical Center network, you don't need to talk to them, because those are important questions. You need to know that you can see your doctors, and there are more plans available than there have ever been before.
Wow.
Which means that it can be more confusing. So get the help that you need. Speak with somebody local.
Again, the information is scrolling at the bottom of the screen. This is Shelli Quenga with Palmetto Project, South Carolina's statewide nonprofit. For more information on Medicare, Medicaid, and health insurance, once again, her information is scrolling at the bottom of the screen. Hey, Shelli, thank you so much for joining us today. And
You're
thank
welcome.
you so much for all of the work and advocacy you're doing in our community to help keep us informed. I appreciate
Absolutely.
you, lady.
Thank you.
All right. Thank you so much. Hey, listen, do you have a story or initiative that could help someone cope with COVID? Please go to booking@copingwithtretailor.com. Booking@copingwithtretailor.com. We would love to talk to you about featuring you on Coping with COVID. Do you have a product or service that could help someone cope with COVID? Please email copingwithtretailor@gmail.com. Copingwithtretailor@gmail.com. That information is scrolling at the bottom of the screen also. Hey, tomorrow, what's new for 2022? We're going to talk to newly elected school board member Robert Lominax and Columbia City Councilwoman-elect Tina Herbert. They're going to tell us now that they have won their prospective races, what their plans are for the city and for the school district in 2022. It's a series that we're going to do with the newly elected officials. Also, Friday, a new Jamie Harrison campaign film is in the works. And these two ladies actually did the film on Bakari Sellers, and they're going to join us tomorrow to tell us all about it. Plus, you heard about the new variant? Well, Dr. Jane Kelly, assistant epidemiologist with DHEC, joins us to tell us all about that also. That's coming up Friday, right here on Coping with COVID. As always, I leave you with a reading from Jesus Calling. There it is right there. And today is no different. December 1st, Jesus says, I love you with an everlasting love, which flows out from the depths of eternity. Before you were born, Jesus said, I knew you. Ponder the awesome mystery of a love that encompasses you from before birth, beyond the grave. Modern man has lost the perspective of eternity. To distract himself from the gaping jaws of death, he engages in ceaseless activity and amusement. The practice of being still in my presence is almost a lost art. But this stillness that enables you to experience my internal love is so important. You need the certainty, Jesus says, of my loving presence in order to weather the storms of life. During times of severe testing, even the best theology can fail you if it isn't accompanied by experimental knowledge of me. Jesus says the ultimate protection against sinking during your life storm, and storm is going to come, is devoting time to develop your friendship with me. That's your Jesus Calling for today. It's Wednesday, December 1st, World AIDS Day. I'm Tre Tailor. Hey, thank you so much for joining us once again. In It Together SC and the Diabetes Action Council of South Carolina present Wellness Wednesday right here on Coping with COVID. Don't forget, go to the In It Together Facebook page and website and find out about all of the great resources and information available about diabetes and diabetes prevention programs. Until the next time, I wish you peace and abundant blessings. Take care, stay well, be blessed, and don't forget to 1, get your vaccination, and 2, wear your mask over your nose and under your chin. We'll see you later.
Coping with COVID and In It Together SC present Wellness Wednesday, brought to you by the Diabetes Action Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Tre Tailor.